So for this guy, all we're doing is called, what are we going to do there? We're doing something called diaphragmatic breath training. So we know that this is kind of a little flat in here, right? The lumbar spine.
Yeah.
So we're going to work on a little bit of that extension. There's a couple really simple rules to this breathing. One is always in through the nose, and then always out through the mouth with lightly pursed lips. So you're not going to just, right? But in your case, we're not going for flexion or exhale. So you're not going to force the exhale. There's none of this.
Okay.
Just, right? Our focus is the inhale. So when you go in through the nose, you're going to fill up your belly. So give it a shot here. Nice. Yeah, do you feel how you were able to get a little bit more?
Yeah, I feel like it's all like chest, but...
You're great at the chest breath. You are. We measured.
So I'm trying to like breathe in.
Yeah, so you want to do this.
I don't know why something doesn't click. I'm like, that's hard to do.
It is because you're not accessing these muscles. Kind of like the knee. You're like, huh?
Yeah.
What? So let's go hook line, bend those knees. Sometimes it's a little easier to do if we're here. Let's give it a shot. So, is it okay if I touch here?
Yeah.
Okay. So I'm gonna go a little bit lower. Is that okay?
Mm-hmm.
I want you to think about where my fingers are right here, and when you breathe in, push my fingers away.
I'm like, I can't.
It's okay. You'll find it. Yep. And out. And do it again all the way down here. Keep going, keep going, keep going. Yep. And breathe out. Let's do two more. Breathe in. Belly, 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 belly. Nice. Out. One more time. Belly, 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 belly. And rest. Make sure you don't hyperventilate. We'll give it a second.
Is it actually moving?
It's moving.
Okay.
We want some more.
Okay, because I'm like, I feel like nothing's happening, but...
You'll see it in the video.
Okay.
It is moving. There is a very clear point where you start to fill up the belly and then it stops and it does move into chest, like you said.
Yeah.
This in itself is not bad. It's good that you have this rib extension. That means this thoracic spine is moving better than we thought too, right? So that's great. There's nothing wrong with that. Just that we want to get this a little bit further. So it is weird and tricky, but like you're gonna like. Yep, push it out.
Yeah.
Push that belly out. What?
It's just funny.
It's weird. There we go.
Yeah.
That was a little bit more. So one breath at a time. Try it again. And if you want, create this feedback loop yourself. Go even lower. Because this is
I'm like, it's easier if I can like feel it.
Yeah. And I didn't want to touch on you, but I would go even lower if I were you. Like with your fingers.
Yeah.
Like, yeah, because this should get all the way down, all the way into your diaphragm. So if this feedback helps because you can feel it moving.
Yeah.
Look, you're already getting
some.
Yeah, you're getting some more out of it.
Yeah.
Nice job. Okay, you ready? So big one in. Yeah, good job. You feeling a little arc in the low back when you do this? Let's see.
A little. Yeah.
I'm just gonna put my hand here and feel it. So belly, 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 belly. There we go.
Am I supposed to try to push it or not?
No, I just wanted you to feel the...
Okay.
It will come with it. What I don't want you to do is throw your back and arch your back.
Okay.
I want it to happen just with the breath, but watch my back when I do the breath too, right?
Okay.
It does extend. But that's different than me because like I can breathe out and throw it back too.
Okay.
That's not what we're going for.
I see.
Try it again.
Yeah.
There we go.
Yeah.
And out. Yeah, chest expansion is beautiful. You're getting a lot of excursion in the ribs. I can see the chest rising. This is going to help with a lot of our probably shoulder movement later, so that's great. Cool. The only contraindication here, of course, is hyperventilation, right? I would stick with 3 to 5 reps at a time. If you do 5, 6, 7, 8, you could get a little dizzy. I mean, it's not a big deal, but...
Yeah, I'm already kind of a little dizzy, so I feel like...
Your blood pressure is probably low already, so...
Yeah,
okay.
definitely.
So you're going to do 3 to 5 at a time. Take a minute in between, catch your breath, relax. This is something that you can do all throughout the day. Maybe do a set or 2 in the morning, maybe do a set or 2 in the afternoon, in between, you're in class. You could even try doing it sitting. Eventually, we're going to move into it sitting together too. So if you want to jumpstart that, if you're not getting pain, try it any which way you want to. If you get pain, don't go off script.
And shoot for like how many times a day?
Probably 2 or 3. Okay. Yeah. So I'm going to write this out, but it's going to be probably 2 to 3 sets at a time of 3 to 5 breaths. Okay. And then you can do that 2 or 3 times a day if you want.
Yeah, that's easy enough.
Any other verbal notes for yourself on this one?
I think so.
Okay. Just remember to fill up belly, and again, even deeper. Like
Okay.
you're gonna get like all the way down there.
Yeah.
Fill that up.
Okay.
Okay.